Hi ma'am, are we online?
Yes, sir.
Okay,
Welcome, sir. Ask me anything session.
thank
So
you so
today we are flooded with the questions. We have lots. We got lots of very questions. So and it's about the FMG exam. As you know, FMG exam is coming very soon. So let's start with one. Sir, how to utilize this 1 month for the FMG exam?
Hi everyone. So welcome aboard to this live session. I'm sure a lot of things are going on in our minds right now. The number one feeling is I've studied so much in the past 1 or 2 months, but unfortunately I'm not able to remember those things. It's a very common feeling that every student gets, irrespective, you might be a topper as well. As a matter of fact, the more you study, the more the feeling of forgetfulness would be there. So, does that mean we does not pass this exam? Of course, no. Please remember this feeling of imperfection that we have right now is the actual way we pass this exam. It's never going to be 100% perfect feeling that I know everything, then you take the exam and you will pass. See, this exam gives you approximately 4.5 months of preparation. Many students think that I wish I had little more time to prepare and I would have passed. That's actually a very wrong thing. Let me just tell you, even if I give you 1 year, still you will ask for more time. That's the way human brain tricks you that you need more time. But actually speaking, you need 1.5 months. This is the game changer. Last 1 month, whatever you're going to do, that will change the game. So, guys, what you need to do is just first have faith in your preparation that whatever you have been studying, some kind of memory has been already created in your brain. And now, what happens is once you finish your course, let's say you're doing some live course, once you're done with your course, 1 month, 1.5 month of time that you will get, that time when we start revising again, things will come back. So, what to do? Okay, until then, try finishing this last subjects what you're preparing right now in such a way that you do not get more time to revise. Think of it like that you're having an exam soon enough. What's gone is gone. Let it be. Like 2 months back, what you studied some subjects, let them be. It's okay if we don't remember them. But now, what you're studying, the last few subjects, 4 or 5 subjects, make sure you study in such a way that you will be able to retain more stuff. Let's get more serious now. Okay, so last 1 month, what you will be doing then is once the revision starts, finish the revisions in the morning. So, whatever you're preparing, take a subjective test of that subject. Once you're done solving the MCQs, do not just solve MCQ right and wrong and you're done with that. Let's say you did something wrong. Please ask yourself what went wrong? Why did you do that wrong? Once you know that topic, read it once again, and then you have rectified yourself for the real exam. So that way, in the last month, 15-20 days, you will be finishing all the subjects. Let's say you're talking about major subjects, give it like 1.5 day. 1.5 day is quite enough even for a big subject because you're not going to get more time than that. That time it is just passive reading of what you have studied, right? You will feel that while reading, you may not remember this, but trust your subconscious. Whatever you're reading, there is something called temporary memory. Somehow in the exam, you will be able to recall things. And trust me when I say this, we've seen thousands of students over the years. And we know one thing for a fact that the exam cannot be answered by remembering everything verbally. Most of the questions you will be just reading and your subconscious mind tells you that this is some option that is going to be correct, and you just choose that, and that leap of faith that you do, and whenever the result comes you will know that you have passed this exam. So stress is inevitable, fear is inevitable, it is going to come no matter how much we say, but as long as you stick to the normal path, you're going to be fine. There is nothing magical in this preparation. just the basics. Revise, revise, and revise. Do MCQs, rectify your mistakes, and soon enough you'll be passing this exam. So I guess this will answer the question, ma'am. Any other
Right, right.
query that you have?
No, no, it's really good. So, sir, any specific like any technique to improvise to retention to memory for
Okay.
the exam?
Okay, sure. And also, I see there is one more question. Should we do an integrated revision? Like one of the
Right,
doctors is asking us that question, idream.mbbs. So, to answer your question, doctor, let me just tell you the integrated questions or the revision that you're asking me about. Actually, it can be done, but the thing is, as long as you're preparing for the first time, there is a lot more stress compared to a person who's preparing for the second time. See, there are two different types of stress. Person who's preparing for the first time has to revise a lot more things compared to somebody who's revising, or let's say giving this exam second, third time. See, the person who's repeating will definitely have an extra edge because they have already finished a lot of subjects. They know quite decent amount of things. The only stress the repeater will have is the numbers in the back of the head. They will be like, this is my second time, this is my third time, and that makes you more scared. That's a different type of a scare. But studies point of view, you're definitely having an extra advantage. Now, coming to the question again, somebody who's repeating, let's say who has already done n number of revisions, you are doing some self studies or whatever, you have joined a coaching, whatever it may be, if you have already done some kind of revision, then what you can do is you can take up pathology, pharmacology, and medicine together. You can take one system like that and do it. Let's say you can take dermatology and microbiology together, because a lot of infections that you see in derma are actually seen in our microbiology also. So that way, definitely it gives you a good feeling, because a lot of topics in medicine are overlap. There will be definitely some integration. When you feel you're studying the derma, you will see, oh, I studied this in micro. Or when you study something in micro, you will feel that I already studied this in ENT. So the thing is, integrations are definitely possible, but most of the things that can be integrated are pathology, pharmacology, medicine together. One system you can take. Like let's say today you do CBS, CBS of path, CBS of pharma, and CBS of medicine. If you do, you will finish like that. Then anatomy and surgery can be done together. That way you will be done. And few other subjects, we can do integration, not for everyone, of course. Okay, so that way you can definitely go ahead. But for somebody preparing for the first time, I don't know, it is a very dicey situation. I cannot say that it's a good approach for you. Why? Because first you need to revise the subjects for the first time, so that itself will take time. So getting lost in the integration may not be a good idea, or maybe it works for you. So for the first time, I would not recommend, but maybe second time, if you're preparing, you're already good with some subjects, you can definitely go ahead with integrations. I hope that answers the question as well. And yes, ma'am, you were asking me a question about retention.
right, sir.
Like how exactly can we, enhance our memory and everything? Guys, there is just one simple thing that you got to understand here. Every doctor, including me, if I don't revise things, will forget. There is nothing that you just read once and you're going to remember that. See, trust me when I say this, studies is the only thing that requires motivation, and studies are the things that whatever we study, we forget. If I ask you some movie plot, let's say I tell you there was this that happened in a movie, and ask you, your brain will be able to recall that movie like this. But the same thing I tell you about a presentation of a case, and I ask you, what is this person having most likely, then that time we have to think. Okay, so what is the only thing that will sharpen our memory? Revision. Now, revision is required for everyone, but especially volatile subjects. Okay, now let me name the volatile subjects that most people will agree to: anatomy, biochemistry, microbiology, pharmacology, PSM. These are the five heavyweights that will be there in your examination. And unfortunately, if you say, I do not like this subject, I'm not going to study, I'll study only OBG, I'll study only surgery, I'll study only ENT and go to the exam. Yes, you will be solving the questions from that, but that will not be enough to pass this exam. If the exam was just in those subjects, then you could have chosen them. But exam is part one and part two, and majority of your part one is the volatile subjects that I just mentioned, something that most students do not like. Please remember one thing: everybody studies the clinical subjects and goes to the exam. That is the bare minimum, right? But the people who will pass this exam, the subjects that will give you the extra edge are these volatiles. So what to do about them? Now is the time you can start. Every day 20 minutes in the morning for one subject, another 20 minutes for another subject. What you can do is 20 minutes in the morning, 20 minutes in the evening. That means approx 45 minutes. What you can do is take one volatile subject. Don't study too much from that. But what you got to do is, let's say, study one topic, just one topic, but how to read it, you change the approach. Let's say you're studying something in microbiology. Let's say a virus called herpes virus. You all know herpes have certain members. Herpes virus 1, 2, 3, 4, 5, 6, 8. There are these members. What do? Don't study too many viruses. Just study only the herpes virus, but read it more number of times. In that 20 minutes, don't aim for perfection. Don't think every line I will memorize. Don't do that. The way the human memory works is, let's say that herpes virus is 2 pages, 3 pages. Quickly read those 3 pages again and again in that 20 minutes. Read it 5 times, read it 10 times if possible. Let's not get our ego in between and say that I've already studied this, I already know this, so why should I read again? The more number of times you read in this last month, the better the memory is going to be, and that's how you can sharpen it. There is no easy way to this, my friends. It's all about hard work. And if you're willing to do the hard work, then soon enough you'll be blessed. Let's forget everything that we have done in the past or whatever. This 1 month can change everything, it can change our life. Let's give our best shot. Okay, so I hope that answers the question, ma'am.
Right, sir. You have covered everything. Yes, sir. We need some guidance about this. So you have cleared everything, and thank you so much, sir, for giving your precious time.
My pleasure, my pleasure. Thank you to the Medway team for organizing this, and I hope we are able to reach a lot of students and they get to,
Yes, sir.
benefit from this, whatever we are saying.
Yes, sir. Sir, one more question is there, like we got just now. So what about GTs?
Okay. Now is the time, I would say. See, people who are studying in the offline coaching centers or live onlines or whatever, I'm sure the course has not been finished yet. You still have subjects going on. So obviously, if you're having a class from morning till evening, it becomes kind of difficult to take a GT during that time. And as I mentioned before, GT is not about just solving the MCQs and you're done, whatever is right, whatever is wrong. You have to do something. What you have to do is you have to revisit the topics you did wrong. Let's say you did one question wrong in gynae, a topic about endometriosis. So what you have to do is, if you did that question wrong, go back to the notes in your, gynecology, check and read the topic endometriosis once again. So that way you will improvise. So GT is not about just solving 300 MCQs if you're thinking like that. We need to actually do the wrong MCQs again, read those topics. That's how we are going to improvise. Okay, so one or two things I will tell you right now. Somebody who's doing self preparation right now and they're not joined any classes, yes, you have time to do a GT. Take as many GTs as possible. Every 15 to 20 days, you should actually be taking a GT if you're doing a self preparation. And do not get bogged down by the GT scores. I can assure you one thing, we are still a month or maybe more away from our examination. Today, you might be scoring 240 in a GT. That doesn't mean in the real exam you will get 240. Today, you're going to score 130 in the GT. That doesn't mean you will not pass this exam. GT scores will fluctuate because GT is today's knowledge that you have. Today you took a GT means today's retention. 20 days, if you don't revise some subjects, you will forget many things and your GT score will go down. Okay. So what I'm saying is GTs do not decide anything, but the reason we take GTs is it's a practice ground for us. For all of us, it gives us one or two things. The first thing being, it gives you the ability to focus for 300 questions. During the classes, sometimes we might be sleeping. It's a fact, right? Your mind is somewhere else. It doesn't matter. You're sitting in the class just physically. It's okay. Mentally, you might be somewhere else. But on the day of exam, all 300 questions, you are alone. You are going to take the exam. So, how will that come? That focus ability will only come if you take GTs. Time management will come if you take GTs. That's why you need to take them, but do not get demotivated or overconfident by the scores of GT, because I know a lot of students who scored 200 plus also who did not pass the real exam, and I know a lot of students who were scoring 110 like that also and they did pass the exam. So what matters in the end once again is how much knowledge do you have on the day of exam, not 1 month before exam, not 1 month after exam. I hope once again it solves the query related to the GT, and I guess that's about it, ma'am.
Yes, yes, sir. You said very well. Basically, we need consistency and hard work. We will achieve everything. Yes,
Correct,
sir.
correct.
Thank you so much, sir.
So
Thank you so much.
wishing all the best to all the students who are preparing for this session. Hopefully, you guys will be passing out with flying colors. All the best, everyone. Thank you, Medway team, once again. Take care.
Thank you, sir. Thank you. Okay, guys. So for today, that's it. We will come next week with another faculty. Till then, stay tuned. Bye bye. Take care.